whenever a patient is going through abdominal or breast surgery, the reality is I try to advise my patients to wait until they've completed their childbearing, because during the tummy tuck procedure, one of the main focuses is correcting the laxity that's developed in the abdominal wall musculature during the pregnancy. This sometimes is just a little bit of laxity, sometimes they have a true what's known as a diastasis. And diastasis is a separation of the muscles. It's not quite a hernia, but it has the similar effect of a hernia in terms of patients oftentimes complain to me that they look like they're pregnant or their lower abdomen's bulging out. So when I do the tummy tuck procedure, the goal is to go in and not only get rid of excess skin, but also tighten up the muscles so that the abdominal wall is flat. It's no longer bulging, but it's just flat up and down. Although you can carry a pregnancy after that, because I tightened the abdomen with permanent sutures, the process of the tightening will restrict the amount of expansion that the abdomen will have. So women can carry a pregnancy after a tummy tuck, but the way in which they carry it, the way in which they manifest, will be a little bit different than they had during their previous pregnancies. It is possible to redo a tummy tuck. Once someone has a tummy tuck and then they get pregnant and they need to have it redone, that is possible. It makes it a little bit more difficult, but it is possible. Sometimes it happens unexpectedly, and there's not much we can do about it other than revisit it after they've had the baby, and then go back, and if there's anything that needs to be revised, we'll go back and revise it. And the same is true to a certain extent of the breast, although less so. The breast tissue will change during pregnancy. That's all in the body's preparation for breastfeeding for the child. Whether or not the mom decides to breastfeed, the breasts do enlarge. They do prepare for breastfeeding during the 40-week gestation, and so the breast will change to a degree, even if they've had previous breast surgery. They probably won't change as much if they've already had a breast lift and breast augmentation. They're probably not going to change as much with a subsequent pregnancy, but they will change to a certain extent.